How to use PURIXAN, a step-by-step guide. Step 1. Shaking the bottle. Wash your hands well with soap and water before and after administering a dose. Before handling PURIXAN, it is advisable that you put on disposable hand gloves. You will need to shake the bottle before use to make sure the medicine is well mixed. When opening a new bottle of PURIXAN, you must shake the medicine vigorously for at least 30 seconds to make sure that the medicine is well mixed. On subsequent uses, 5 seconds will be enough. Step 2. Withdrawing a dose. Remove the child-resistant cap and push the ribbed end of adapter into the neck of the bottle until it is firmly in place. The bottom edge of the adapter should fully contact the top rim of the bottle. Do not remove the adapter from the bottle after it is inserted. It remains in place for future doses. Next, choose the correct oral dispensing syringe. Your doctor or pharmacist will advise you of the correct oral dispensing syringe to use in order to give the correct dose. This will be either a 1 milliliter oral dispensing syringe or a 5 milliliter oral dispensing syringe. Next, push the tip of the correct oral dispensing syringe into the hole in the adapter. Turn the bottle upside down. Pull back slowly on the plunger of the oral dispensing syringe to withdraw the prescribed dose of PURIXAN so that the medicine is drawn from the bottle into the syringe. And then eject the medicine back into the bottle to eliminate air bubbles. This process will need to be repeated several times until all air bubbles are eliminated. Pull the plunger back to the point on the scale that corresponds to the dose prescribed. If you are not sure about how much medicine to draw into the oral dispensing syringe, always ask your doctor, pharmacist, or nurse for advice. Leave the oral dispensing syringe in the bottle adapter and turn the bottle right side up. Place the bottle onto a flat surface. Hold the oral dispensing syringe by the barrel and carefully remove it from the adapter. Do not hold the oral dispensing syringe by the plunger because the plunger may come out. Place the tip of the oral dispensing syringe in your mouth and aim the tip toward the inside of your cheek. Gently squirt the PURIXAN oral suspension into your mouth by pushing on the plunger until the oral dispensing syringe is empty. Do not forcefully push on the plunger. Do not squirt the medicine to the back of your mouth or throat. This may cause you to choke. Remove the oral dispensing syringe from your mouth. Swallow the dose of PURIXAN and then drink some water, making sure no medicine is left in your mouth. Put the cap back on the bottle with the adapter left in place. Ensure that the cap is tightly closed. Step 3. Washing the oral dispensing syringe. Wash the oral dispensing syringe with warm, soapy water and rinse well. Hold the oral dispensing syringe under water and move the plunger up and down several times to make sure the inside of the oral dispensing syringe is clean. Expel all water after rinsing. Let the oral dispensing syringe dry completely before you use it again for dosing. Do not throw away the oral dispensing syringe after use. Store the oral dispensing syringe in a hygienic place with the medicine. Refer to patient information for further storage instructions.